So welcome everybody. Thank you so much for being here and for joining us for another episode on our Autism Parenting series. Today we have Dr. Jalila Abdul Rahim. She is a leader in the industry of nursing. Dr. Jalil Abdul Rahim works full-time as a department head of nursing and allied health at Redlands Community College and part-time at SWOSU as a graduate adjunct professor. She has been a registered nurse for 15 years with clinical experience in adult and pediatric medical, surgical, home health, and case management. She has been in nursing education for the past 13 years. She currently holds certifications as a certified nurse educator, board certified cognitive specialist, and a certified healthcare simulation educator. She has recently founded and is CEO of J. Atifa RN Support Services, LLC, to equip families and professionals with the tools to identify triggers, develop proactive strategies, and gain control over challenging situations through free resources, expert guidance, and education. She's published 2 books, her memoir, Unexpected Experiences Beyond Autism, and the resource companion, Unexpected Experiences Beyond Beyond Autism, to serve as a resource for those she plans to serve with her business. She loves spending time with loved ones, exercising, traveling, and reading during her free time. Thank you so much and welcome, Dr. Jalila. It is a pleasure to have you. Your bio is amazing. And thank you for all that you do and contribute to the autism population and the field of nursing. Welcome.
Thank you. Thank you for having me. Happy to be here.
That's wonderful. So the theme of our discussion today is balancing care, medication strategies for children with autism. And so I think it's a very appropriate theme for you to discuss because you're a mom of a child on the spectrum who was diagnosed several years ago, and you have medical background. You work with medication management, you administer medications, you're aware of what substances are contained with. And as a mom, you've been able to sort of observe the administration of different medications and their reactions, right? And so you're really a wonderful resource to a lot of our parents watching, just on how to navigate that whole issue. And so we have some questions that our audience would like to know about. So question number 1, in your experience, what are some symptoms and presentations that... So question number 1, in your experience, what are some symptoms and presentations that would prompt a parent to consider medication interventions for their child with autism?
So to be pretty broad, initially, some situations or presentations that might prompt a parent to consider medication administration, or if they see any worsening or exacerbation, which just means any huge changes of any previous symptoms. If you've tried any holistic measures before in its entirety, that's been exhausted. So for instance, I've tried essential oils. I've tried the food route, different foods. I've tried aromatherapy. I've tried detoxing with Epsom salts and things like that to pull some of the heavy metals out. So if you see any worsening, if you tried those holistic measures and they just aren't cutting it, or you just see symptoms just negatively impacting your child and their ability to participate in their daily life, or changes in school is typically a big one. Like if their academic performance is changing, or they're having difficulty with their peers outside of what's normal for them, or if you see any changes like any extracurricular activities that stick out to you. Yeah, and so like to kind of piggyback on that, a few symptoms to be a little bit more specific or like if they have any increase in anxiety or mood regulation. So we know, that kind of fluctuates depending on the circumstance. But if it's getting to a point where you're noticing, okay, this is not typically the norm for them, that may require a medication intervention. If they have sleeping problems, that may require medication intervention as well. Increased aggression, any challenges with learning, and then also any self-harming behaviors or harming behaviors toward others as well.
Yeah.
The self-harming and the harmful behaviors to others, honestly, for me as a parent, was the pivotal moment for me that prompted me to consider medication intervention, because I was very hesitant to do so. Although I was, as a nurse, I've given them several medications to several children. I just wanted to exhaust every measure. So, yeah.
Right. I understand what you're saying. So really, this requires for parents to understand and know and have observed their child before and be able to recognize when their behavior is outside normal limits for themselves, right?
Absolutely.
So
Absolutely.
the choice to administer medications or even consider that for your child is a case by case specific to the child instance, right?
Mhm.
And you would recommend that when behaviors become injurious or self-injurious, really a serious conversation about medication administration should take place.
Absolutely.
Yeah, that's great. So Dr. Jalila, talk to us about how do parents know when to make a medication change? And how do they approach doctors about that request? Because it can be a little bit intimidating, I'm understanding.
It is very intimidating, especially with their limited time. Sometimes, some providers may not have, or doctors, they may not have the best bedside manner, so you may not necessarily know what to say to them. And then, some parents just feel like, they don't have that insight to bring to the table to really make their case. So as far as when to follow up with the need of medication changes or something that you may see that may require that, typically our children, they're in that rapid growth of development. And so I don't know if most people know this or not, but medications are prescribed to children based on their weight. So as they grow and their weight changes, then their medications will need to be adjusted. The other big thing is when they're in that pre-puberty and that puberty stage, that's typically another time where medications will need to be adjusted just from that rapid growth and all those hormonal changes. It just kind of disrupts their system. And so what was effective before may not be effective at that time. And they may even require an increase in some of their dosages.
Mm,
Um, and then also, if your child is allergic to a medication, and sometimes they just develop sensitivities from taking it over time, um, or if they have any of those, what we call in the medical world adverse effects, which is those more severe effects that could happen, but are something you need to follow up on. So we all know, like allergic reaction, you may see a rash, trouble breathing, itching, things like that. But if you have a medication, I know been a few that my son's been on, and it just totally disrupts his blood work. His triglycerides was very high. He gained a lot of weight. His blood sugars was kind of out of whack. So things like that will prompt you to go follow up with your doctor to see what adjustments could be made. And then of course, any side effects is what we consider, if you take the medicine, we expect for you to have it, right? So if
mhm.
you take something like albuterol, we expect for a child to be kind of jittery and hyperactive a little bit afterwards. However, with those, if the side effects are something that your child cannot tolerate, by all means, please advocate for yourself and your child, and inform your provider, because that does not necessarily mean you have to stick with that medication if you can't handle those side effects. Um, so as far as communicating to your doctors, what we do as nurses, and there's a few different communication um, frameworks that we use. So one that I like to reference is called an IS bar or an S bar. And it's real, I like to simplify things. So this works really well for me. So this is just kind of what I pass along. So if you feel like you don't really know how to communicate it, because what doctors look for is something that's real quick. They want you to tell them what's wrong quick. So it's kind of like time is of the essence. So you want to make sure you map out, you identify whatever the problem is. So I need the medication change, whether I need the dosage change or I need to try another medication is what I'm thinking. You want to tell them the situation, which is that S. So, hey, they're having increased aggression at school. They've been hitting peers. We've been getting more complaints than usual, which is outside of their normal behavior. Then you want to tell a little bit about their background if the doctor's not as familiar, so we've taken this medication before, they were fine, interacted with peers just fine. Now all of a sudden it's a problem and they haven't been interacting the way they should, in the past 2 weeks. You want to tell them that, because they'll ask that, they want to know how long. And then you want to give them what we call is assessment data, and it's just basically what you've observed your child doing. um, what are they telling you? Because sometimes, typically children, when they hit about that pre-puberty stage, they start telling you, I don't like how this medicine makes me feel, or I don't like the side effect, or puberty age, I just don't want to take it because my friends don't take it or aren't taking medicines. And then lastly, you want to end with whatever you as a parent recommend. Your voice and your opinion is valid and it's necessary. So even if it's something along the lines of, I would like to see changes in medication so that their school performance will improve.
Mhm.
That's things that I was very adamant about with my son. Hey, I want him to focus in school, and sit a little longer in the chair and actually be able to sit long enough for them to do a test or whatever the case may be, so they know that he's grasping the information.
Yeah.
So,
That's a great suggestion. So, first of all, parents should expect that as the growth curve changes, the dosage will change,
mm-hmm,
right?
mm-hmm,
Um, Also, when speaking to doctors, it sounds like a couple of things. Parents have to think ahead and be able to state their case in a very succinct and clear way. It sounds like that they need to talk about what's the issue, what are the presentations, and then what are their personal impressions about it. Um, I know when I was just a new mom and you take your baby for those vaccinations and stuff. I used to write down what I observed the reaction to be. Do you recommend parents should be writing things down when the drugs change and when there's new medications?
absolutely. Absolutely. We always tell you, keep a list. So, and that's keeping a list on hand. I'm one of those, I just put it in my phone. So you always have to have it ready to go. But I'm very adamant about making those notes of, okay, so we had this medication, this happened, so that you have something to reference. But yes, doctors really like to see a trend. They like to see a
Mm,
trend to where they can kind of walk alongside the story with you in a very quick way to help them come to whatever decision they need to make quickly. If they feel like they can't really make that distinction, then they're less likely to move on it. So they most
mm,
definitely need to be tracking and taking note of
right.
how the child's responding to the medications.
Right. So I guess in my second question, the big takeaway for parents is that they need to plan ahead of time, kind of what they would like the outcome to be based on what they're seeing, how the child feels, what the reactions are, and kind of just lay it out for the doctor to help them make a decision. It doesn't do anybody any good to go in kind of vague and unclear with a whole big long narrative, right? Just get to the
Right,
point, but plan out what you're going to say and for an expected outcome.
right, right,
Yeah.
right.
Yeah, that's great advice. I don't think anybody tells parents. That's great. So Dr. Jalila, you have so much experience and so much knowledge in this topic, firsthand experience with your son, and so much knowledge as a healthcare professional. Could you share your thoughts on combining prescription medications with holistic treatments for care management of children with autism? And so I just want to preference this by saying, um, I know you're a medical provider and you're under certain obligations to administer things by the manufacturer's recommendation, right?
Mhm.
But as a mom, you have intuition, and then as a family, you have your own, I guess, values about food, about medicine, and you combine all those things to make decisions. So could you let us know a little bit about how combining prescription meds and holistic natural remedies, how that's been, and anything you'd like to share regarding that?
Okay. Well, first, I just want to say when it comes to that, make sure that when you're talking with your doctors, you're letting them know what you're trying, So you don't necessarily want to use a prescription medicine with some type of holistic treatment, and it can be, something as simple as some of the essential oils, or for instance, or a supplement. So my son is very deficient in magnesium. I can give him those little magnesium gummies, and it helps him relax. It kind of puts him at ease. But he is also on a medication called clonidine, which is typically prescribed for high blood pressure, and it's prescribed specifically for him to control his anxiety. But the interaction with that clonidine and that magnesium, the magnesium can decrease those effects of the clonidine. So you'll be given that medicine, and then you're thinking, hey, he's still kind of revved up or seem a little off balance, and really they're kind of counteracting each other, right?
Mhm.
So that's just an example of why you want to, loop your doctor in on, what you're thinking as far as those treatments. But I will say that in my experience using prescription medication, as long as you know that there's not interactions and things like that, with those holistic treatments, I feel like that gives your child a better outcome, so to speak. I can't say what, I don't want to say, medicines is the greatest or the worst, because it just depends on the child and the circumstance. In my experience with my son, which has been a little different than, being a nurse and taking care of other little ones. You have to get a little creative. So some of the things like, so he's on that clonidine, so we like those magnesium gummies, but I also like Epsom salt, to pull those metals out. That has magnesium in it as well. So I would, try to decrease the frequency that I use that, or maybe if he's taking a medicine in the morning time for like the clonidine in the morning time, then it's okay to do the mag at night to kind of spread it out. Um, when you follow with your doctor, kind of knowing how long those medications will stay in your system too, are really big things to know when you're kind of putting some things together. So my son's also on ADHD medication. Those are one of the medications that once it wears off, and it's out of your system. So then if you add something on after the fact, you don't really have to worry about that interacting too much. But in my experience, I feel like a little blend of the medications and then those holistic treatments, whether it's the over-the-counter medications, whether it's the supplements, whether it's essential oils. I'm still real big on essential oil blends. Um, that combination has really gotten my son to a good point, and also as a parent made me feel like I have options, because a lot of times when you deal with the medications, if you don't, I'm thankful to have the background that I do have to know how to tweak them if I need to, but not everyone knows that. And that's not something, I would encourage parents to do on their own. So sometimes you may be in a situation where maybe it's a holiday weekend and you can't get to your doctor, and your child's behaviors are just out of the typical norm. And so you want to try something else to kind of get them back in balance, until you can follow up. So using those holistic treatments they've for me, they've been very beneficial. I know magnesium is like our biggest one that we've used. We've used a little bit of the CBD oil as well. We've looped the provider in on that as well when we've tried that, to help with his aggression. And then we do sleep aids. I don't really do too much melatonin. I used to do that, but it just he had a lot of nightmares with that, and he was itchy, so he didn't like those side effects. So we do ashwagandha.
Oh, I
So
love that.
yeah,
Mhm.
that's a good supplement that helps him just sleep at night. So, I know there's children with autism that has sleep issues. So that's one option, that you may consider looking at, something like that to help with the sleep issues if you don't want to go the medication route, or if it doesn't interact with the medications that they're currently on.
Yeah, that is excellent. And I think really valuable information for parents. So you recommend primarily first before anything that the provider is part of that conversation, that they know everything. And no holistic treatment is too small. So something topical like a lavender oil or something,
Mhm.
even as right, is still absorbed into the
Mhm.
bloodstream, and the medical providers should know about everything they're using, consuming, um, or applying, right? So always tell the healthcare provider. And then it seems like you really, that's been an instrument in balanced care. You've really been able to expand the options outside of traditional pharmaceutical drugs. Um, Also, the holistic treatments, it sounds like a lot of them are very gentle to the system too.
That you are, yes. You are absolutely correct with that. They are a lot more gentle, and typically too, when you think holistic, you think even about the diet and the environmental changes, because that all facilitates, some of those supplements and those medications. We don't do any nitrates, what you would get in those processed meats, red and yellow dyes that causes him to act up. I mean, he was a Cool Ranch Dorito kid, and then, I told him, I said, we can't do that, because that's not going to work out. And I remember the day where it just kind of clicked in his brain. He went to school and he said, I'm going to just try to eat a little bit of this, and had a bad day. And you cannot pay him to eat a Dorito because he knows it just, affects how he feels. So yes, yes. And even, I'm very structured. I wouldn't call myself a neat freak, but I'm very organized in a sense. So even his environment, I'm a, aromatherapy. I have those oils going. And I like to keep stuff clear where we can see certain spaces,
Right.
things like that. And that just kind of helps him relax and kind of keeps his mental state where he doesn't seem as cluttered, and that helps facilitate those medicines and those other holistic treatments that you use. It helps them be more effective, because there's less barriers that
Absolutely.
come.
Yeah, right. Absolutely. There's kind of something I have to say about that. So my experience with some homeopathic treatments and interventions, and how they differ from pharmaceutical drugs, I think you can kind of, well, you can kind of skip a day. You can get on and off. You can with pharmaceutical drugs and they'll still work.
Mm-hmm.
But with holistic treatments, you got to really be consistent with it, let it build up in your bloodstream, and to see the effectiveness of it over time.
Absolutely.
What are your thoughts about that?
I would agree. I would agree. Consistency is key with those homeopathic medications and regimens. And I think that is something that I see people give up on too soon because it takes time. It takes time, and the more that you're consistent with it, then you start to see those effects versus The prescribed medication, yes, you would typically see that a little quicker. And with the holistic or the homeopathic medications and supplements, you can even, after you've gotten accustomed to it, and you've been consistent and stuff, it doesn't really harm your child that much if you end up forgetting one day to not do it or something like that, versus a prescribed medication. Depending on what it is, sometimes you can skip a dose unintentionally, and it just throws your child system all the way off. I've had that experience not only with some clients that I've taken care of in the hospital setting, but with my son as well. It took me, a few weeks to get him balanced off, because some of those medications you can't stop abruptly. You can't really skip. You have to taper off, and you have to watch certain things. But with those holistic and homeopathic regimens, you can, as long as you're consistent, those are, I mean, I feel like they're the way to go. That's my preference. I know I'm doing a blend of both because I just needed to. But yes.
Right. Yeah, I think it's excellent. It's really good. Um, and so you spoke a little bit about diet. I'll say that a lot of families really are struggling with their spectrum kids to have them eat at all, right? And there's because of the sensory deficits, they may just really just only eat crunchy things, right? Crackers and chips and stuff like that. How can parents be conscious of the diet and the chemicals and the preservatives and the colors and all this, but still be satisfying the caloric requirements, the nutrient requirements of their child, and the preference,
The biggest thing that I would tell parents is to start slow. Choose, I would, because typically they also have the issues with textures of food. Choose whatever they will eat and see how you can adapt it. So, for instance, and it took me some years to do this, but I started eating low carb just because I have polycystic ovarian syndrome. So, I was trying to balance my hormonal state out, and just kind of playing with those recipes. My son was not a fan, he just was not. So I've had to get a little creative. He will eat some of those things, and he doesn't like textures that's sticky or anything like that. So but he liked, for instance, like chicken nuggets, but I was trying to get away from the processed meats and things like that. So I would just try to bread the nuggets in what I could, with gluten-free flour, whatever the case may be, and then like pop it in the air fryer, and it was still crunchy. And he didn't know the difference, So I started doing things like that, to get him to be a little bit more receptive to that. And he was very minimal in what he would eat. So I just kind of played with what he would eat in different ways and minimize things here and there. Whether it was starting with, okay, let me try this gluten-free ingredient or whatever the case may be. And then over time, after you kind of get your bearings and they have a little system of what their preferences are, then you'll feel a little bit more grounded in being able to have a more comprehensive diet like that over time.
Yeah.
Even though I'm a nurse, if I'm gonna be completely honest with you, that's one of the things that our pediatrician told us. Okay, well, you have to cut his diet and this, and that. And for a lot of us, it's just all I seen was dollar signs flying up, and where's the money coming for me to pay for those type of groceries, and he won't eat it. And so I had to even tell myself, with him, I'm just going to start slow and be patient and start with a few things at a time and find his texture preferences. Now he'll eat low carb pancakes. He doesn't know the difference. I make them with coconut flour and almond flour. He doesn't know the difference. And then he'll eat the sugar-free syrup because sugar sets him off.
Yeah.
So it took me a little bit to, figure out what syrup, and sometimes I will make it myself, or mix it with like a little bit of honey, and he, so I You just kind of have to get creative, but definitely start with whatever their preferences are and start slow and just think about how can I adapt the one food maybe that they will be receptive to without ruining it. You don't want to try to make an alternate version of French fries if that's what they like to eat, and then all of a sudden it's like, I made that mistake before. So don't do
Right,
that. You
right.
know,
Yeah.
so
I got to expand your bio. Mom, nurse, chef. Um, so my last question, in the line of the balancing holistic and prescription drugs, is there a list out there or a website that parents can go to know the drug interactions, or that they could type in what they're doing?
Yes, the one that comes to mind, and this is just because I teach, these pharmacology courses, drug.com is like one of the biggest. That's the one that I reference to. But you can look and see what medicines are compatible, even if you're on a lot of them, they'll show you the interactions. And what I always tell people when they go to adverse effects and side effects, because it seems like it's so many for so many drugs, whatever is listed first is typically the most common reactions. So don't go all the way toward the end of the paragraph and like, okay, so this may happen, because those are typically more of the rare ones. So I
Okay.
just start with those first five, that way you're not overwhelming yourself. But drug.com is the best, that I know that's pretty credible.
Okay.
Because
Yeah.
drugs change all the time, but that website stays up to date pretty well with the add them. Yeah.
Yeah. I'm gonna have to go there. That's wonderful. That's a wonderful resource. I didn't know about it. We would only find out from you, a healthcare professional. So you're telling people that so like out of a population of 100, like the majority of the people, maybe 90% or up, are gonna have those first reactions, and then as we go down, it's gonna be less and less of the population that experiences those adverse side effects.
Mm-hmm.
That's good
Mm-hmm.
to know, to be able to read it like that.
Mm-hmm.
Amazing, just amazing. I hope that this has served a lot of moms and dads, caregivers, other healthcare professionals, allied health professionals really, really well. This has been amazing. I hope we can collaborate again. I thank you so much. I loved it.
Thank you. I'm like I said, I'm happy to be here, and I'm grateful for the opportunity. And any way that I can help other people, I'm all for it.
It's not a problem. You're more than welcome. And thank you. Thank you so much. Okay, everybody, take care. Have a good day. Bye.